Simone Biles has shared another medical update, revealing that she underwent an unspecified procedure on July 22, 2026, less than 2 months after describing a separate health emergency as one of the most frightening experiences of her life. Her husband, Indianapolis Colts safety Jonathan Owens, accompanied her even though the appointment fell on his 31st birthday. But despite the timing, one crucial detail remains unanswered. Simone has not publicly confirmed that this procedure was connected to what happened in June. That distinction matters because several headlines have placed the two events together, creating the impression that the July procedure was necessarily treatment for the earlier emergency. The public timeline makes that possible, but it does not establish it. Simone has not disclosed the procedure's purpose, the medical condition involved, whether it was planned in advance or whether it took place in a hospital or another medical facility. For verified entertainment updates without the rumors, subscribe to Startline Entertainment. The newest information came through Simone's Instagram story on July 23rd. She posted a black and white photograph showing herself in medical clothing beside Jonathan and explained that he had taken her to her procedure on his birthday the previous day. She appeared to be smiling in the picture, but a photograph cannot establish her diagnosis, recovery status, or prognosis. Simone provided no additional medical explanation. Even the terminology needs to remain precise. Simone called it a procedure. Some secondary headlines have described it as surgery, but she did not publicly use that word in the material available at publication. Until she or an authorized representative offers more information, procedure is the most accurate description. To understand why the new photograph immediately drew concern, the timeline goes back to early June. On June 6th, Simone posted an image of her arm wearing several patient wristbands. She said she had spent the week resting in bed after a health scare and described the experience as among the most frightening of her life. She also said Jonathan had been in Indianapolis for football practices while it occurred. Jonathan's presence in Indianapolis was consistent with his professional schedule. The Colts officially announced on March 17th that they had signed the veteran safety after his previous seasons with the Houston Texans, Green Bay Packers, and Chicago Bears. The team also identified Simone as his wife and an 11-time Olympic medalist. Simone's June message was unusually personal because, as she explained, she generally values medical privacy. She thanked the friends and relatives who checked on her, visited and sent flowers, but did not identify the emergency. She indicated that she might explain eventually rather than promising an immediate disclosure. That decision created a difficult public dynamic. Simone had told millions of followers that the incident could have ended very differently, but she had also made clear that she was not prepared to provide the medical details. When she later shared vacation photographs from Belize, some commenters treated her public activity as evidence that the emergency could not have been serious. Simone answered that criticism directly. She said the vacation had become part of allowing herself to heal and appreciate being alive following the medical emergency. When another follower asked for the promised explanation, she responded that she was not ready to discuss it yet. Jonathan also asked people to show greater grace because a life-changing experience can alter someone's perspective. That exchange provides important context for the July update. Simone has not disappeared from public life, but appearing at an event or taking a trip does not prove that every health concern has ended. It also does not establish that the later procedure was emergency treatment. Public activity and private medical care can exist at the same time, and the available record does not support stronger conclusions. By July 15th, Simone and Jonathan had returned to a major public event together, attending the 2026 ESPYS Awards in New York City. She walked the red carpet, posed for photographs, and appeared at the ceremony 1 week before the procedure. That confirms that she had resumed some public appearances, but it should not be framed as an official medical clearance or proof of complete recovery. Then came Jonathan's birthday on July 22nd. The couple's plans included Simone's medical appointment, and her post highlighted Jonathan's support rather than offering a clinical explanation. Entertainment Weekly also reported that he had surprised her with flowers after she returned home from a trip shortly before his birthday. This changes the story in one clear way. In June, Simone emphasized how frightening it had been to face the emergency while Jonathan was away at practice. In July, he was physically present for the procedure. That contrast is supported by her own public messages. What it does not tell us is what doctors treated, whether the procedure was follow-up care or whether the earlier emergency has been resolved. There are several details viewers should resist trying to fill in. No diagnosis has been announced. No physician or hospital statement has been released. Simone has not identified an organ, injury, illness, or complication. There is also no confirmed public prognosis and no authorized statement connecting the July appointment to the June emergency. The phrase suggesting that Simone nearly died came from Simone herself, making it appropriate to report as her description of the experience. But it is not a substitute for medical records, and it does not give outside observers enough information to name the condition. Social media theories circulating without confirmation should not be repeated as possible diagnoses. Another point of confusion involves the wording that Simone was back in the hospital. The photograph clearly placed her in a medical setting, and she confirmed a procedure. However, the available post did not specify whether she was formally admitted, treated as an outpatient, or seen in a specialized clinic. Underwent a procedure is therefore more precise than claiming another hospitalization. The public response also raises a wider question about how much information a public figure owes after voluntarily mentioning a health emergency. Simone chose to alert followers because the experience had been severe and emotionally significant. That choice did not remove her right to decide when, or whether, to reveal a diagnosis. Her later responses suggest she wanted acknowledgement and compassion without having to publish her full medical history. The Startline takeaway is that the newest development confirms medical care, not a medical explanation. Simone underwent a procedure. Jonathan accompanied her, and the appointment occurred weeks after the emergency she described in June. The timing naturally creates questions, but timing alone does not prove causation. What changed is that Simone has now provided a second public glimpse of her health journey. What has not changed is her boundary around the underlying details. Viewers should not assume that her ESPYS appearance meant she was fully recovered, that the July procedure proves her condition worsened, or that the two medical events involve the same issue. As of July 24th, no newer public statement located in the available reporting identifies the procedure or confirms its relationship to the June emergency. The clearest current status is that Simone has resumed some travel and appearances, received medical care on July 22nd, and continues to control how much of the story she shares. The next meaningful update will not come from analyzing her clothing, travel schedule, or facial expression. It will come if Simone, her representative, or an authorized medical source chooses to release additional facts. Until then, the unanswered part of this story should remain unanswered.